Hi, everybody, again. Welcome to the webinar, Third-Party Risk Management in Healthcare. Subtitle, Does Anybody Care About My Data? I know Steve and Linda will address this, among other topics. I do want to make note of a couple things. One is the webinar is being recorded, so we will be able to provide you a link, and you can view this later on and share it with colleagues and friends. We also have a Q&A box at the bottom, and if you could use that to ask your questions, we will address them real time if possible, and certainly by the end of the webinar. So thanks a lot, everybody, for joining us. I know everybody's busy, especially in healthcare, and I know there was the large HIMSS conference. The National HIMSS conference was last week, and I'm sure some of you were there. So let me, without further delay, introduce Steve Roesing, President and CEO of ASMGi. Take it away, Steve.
Thanks, Paul. Thanks all of you for attending today. What a great topic. We're going to talk about third-party risk in healthcare specifically, and I just think it's incredibly relevant and a great topic. I'm Steve Roesing, CEO of ASMGi. We provide services to industry and specifically to verticals, including healthcare. Right, so it's great from that perspective. And Linda, joining me today is Linda Tuck Chapman. Thank you, Linda, for being here. And maybe you can introduce yourself a little bit. I have a slide in case you forget.
Just okay to forget who I was. Anyhow, well, thanks so much for inviting me, Steve. I like working with you every time we get on the phone, which we did today for a pretty pre-call. There's always so much to talk about. We're both very passionate about this topic. So I'm Linda Tuck Chapman. I'm CEO of Third Party Risk Institute. And our mission in life is to try and improve the practices around third-party risk management by creating training and education, certification, and a global network of people who can come together and discuss matters relating to third-party risk management. Now, I know that your spouses aren't that interested, but we are. So anyhow, so I have a couple of books. I have the book that's listed here, which is Third-Party Risk Management, Driving Enterprise Value. It's in its second edition. I've also written another book called Third-Party Risk Management, a Practical Guide. It's, as I said, it's much more sort of down to the nitty-gritty, and it's complementary to the first book. And they're both available on Amazon. And we offer really the gold standard in certification programs, certified third-party risk management professional. And we have quite a large number of people who have graduated from the program, and I'm really proud of it. So we offer other training as well, but that's kind of our flagship. So I have a lot of background. I've been in corporate, so you can see, everybody can read, but I've been actually specialized in this area since 2008. So there's really nothing else that I focus on. So I love this topic. There's always so much to learn. And, it's a world where static and things never changed. We would find that we would quickly run out of topics, but that's just never the case when it comes to risk. So that's me. Thanks, Steve.
Awesome. Thank you, Linda. Thanks for being here. I just wanted to mention that we have a giveaway as part of this webinar, or for the attendees of this webinar. And it is Linda's book, by the way. So thank you, Linda. And thanks for writing this book. But it's a great introduction, and it covers a lot of really meaty topics in third-party risk, and it's a great read. So I would highly recommend that. But send ASMGi an email, and we'll send you a book. Right? But in any event, what are we going to talk about specifically today from an agenda perspective? So we'll do a little bit of an overview of the session and third-party risk in healthcare, and then we'll pose some questions and get your thoughts, Linda, and have a discussion around those, and we'll open it up for questions from the audience. But literally, anytime you have a question, just raise your hand or enter it in the chat, and we'll try our best to get to it. And then we'll do some closing remarks and announcements and such. So from an overview standpoint, I just want to mention, like, healthcare specifically as a vertical is third-party risk is very important. And like, why is that? I think, the reason third-party risk is so important is because there are so many third parties, right? If you think about a healthcare organization, they can't do anything without third parties, right? So they bring in vendor equipment all the time, and I think that's a big portion of it. So if and aside from that, they have protected data, right? They have a lot of very sensitive data, and if you think about that, it becomes ripe for third-party risk. The current situation, over 1,320, third parties under contract for the average association. We know big systems have more, and maybe there may be some smaller systems with less. But of those, like a third of the companies in the country don't do assessments each year.
I have to tell you, that shocks me, Steve, because if you look at the environment for healthcare, it's really, I think it's a very unusual environment to operate in. Because as you said, these are large, complex organizations in many cases, and sometimes they're small, complex organizations. But the extended enterprise for a healthcare organization is different than a lot of other companies. And the reason for that is really the variety of third parties they do business with in order to deliver patient care and services. So, when we talk about third parties, we're not just talking about vendors, right? Vendors are pretty straightforward. Generally speaking, you know how to figure out who's a vendor. They're in your accounts payable system. But one of the things when we were preparing for this, we were talking about really what does that extended enterprise look like? And the extended enterprise consists of course, vendors, but there's lots of other business relationships that are necessary. So they're referred to in this sector as business associates. And that's what I would call a non-vendor third party, right? So it's not a vendor, but it is essential and you're doing business with them and they're not an employee. So you've got the business associates, and then, and then the vendors are providing both a combination of services. Some of them are very healthcare related, some of them are technical. And then we also have all the medical devices. So I just wanted to comment, this is a fairly complex environment over which is very hard to have control because it's so reliant on those relationships to deliver the services to patients.
Awesome. Well, great. And this survey was by Ponymon, and it also found that that healthcare companies were most interested in, I'll say, the following 4 features of immediate access to vendor assessments, continuous monitoring. Even once per year, in my opinion, is not enough to assess risk, right? So if you're going to adequately assess or appropriately assess risk, it's got to be continuous, in my opinion. So standardized questionnaires, we know that's a problem. It has been forever, and it still is, right? So anyway, there are a lot of things that are driving the need for third-party risk in healthcare specifically.
Well, if I could add some data points, first of all, I just want to acknowledge that Larry Poneman and Poneman Institute, they do very, very good surveys. So they're very reliable. And if you're not familiar with Poneman Institute surveys, you should be, right? They're the ones often who underpin the IBM studies, et cetera. So there's good material out there. But I did a little bit of research of my own, Steve, when I was preparing for this, because that's just what I do, because when I write a book, I like to have data points. So well, you talk about this complex extended enterprise, but then I was looking at some of the information available by the AHA, which is, very reliable information. And so not only do we have the complex extended enterprise, but apparently just for 2022, there were, let me see, they said that there were, of all the organizations they surveyed, that 55% of them had some sort of cybersecurity breach and third-party data, or some sort of third-party related data breach in the past year. And of those, the top 10 healthcare data breaches in the US, then 7 out of 10 were as a result of relationship with a third party of some form that had weak controls. So when you put that in the context of, sort of stepping back and looking at the average number of relationships you have, the complexity of those relationships, some of them with, let's say that it's 1 or 2 people in a company, right, providing some niche service or something big. you get this really complex set of relationships out there. And then you get 7 out of 10 are causing your organization some sort of cybersecurity breach. That really does state the case to me that third-party risk management in this sector really needs to step up, right? There's been a lot of, I mean, the work on compliance side is really, really the best in class, probably across many, many industries, right? Because the compliance side of healthcare is very often about patient safety. So that's, you know, that, or you're funded by Medicare or Medicaid or whatever. There's some very strong reasons to pay attention to compliance. Risk management from a third party perspective is actually still, in my opinion, in this sector, still kind of coming along, right? There's a lot of work to be done by most organizations to come up to snuff in terms of today's environment and what the risks are out there. So it's back to what Paul said in the introduction, like, does anybody care about my data? Gosh, you should. You should, because you know what? If you're in the health services sector, patients, the last thing they think about is you're going to lose their data or it's going to be breached. They're most concerned about healthcare, but they do expect that their data is protected because it's very, very personal and it's very confidential. So that's my 2 cents on that.
I agree with those things. So there's a lot of words on this slide, and I don't expect anybody to read all of them, but I just wanted to point out what I think is most interesting about this is that the Ponymon conducted this survey, and the report shows that 2/3 of the respondents think they're manual, so they're using manual processes. They don't think they're adequate to keep up with the threats, right? There are a lot of data breaches going on and a lot of threats of data breaches and those kind of things. And I think the attackers in general are getting more sophisticated, not less sophisticated, right? So they're finding new ways in, and the proliferation of medical devices, and you know, it just, from an attack surface perspective, it's increasing a lot. So they just 2/3 of respondents think that the manual processes are not going to keep up with threats. What do you think about that?
Let me be a little more direct about that. If you are trying to do this manually, you're a larger organization. I mean, it doesn't really kind of matter what size you are. If you are doing this manually, trying to identify, assess, manage, and control your third-party population with Excel spreadsheets and SharePoint, I like to say, kill me now, because you're so bogged down in tasks that it's not possible for you to really manage risk. So if I look at a lot of organizations that I'm aware of, I mean, I certainly have worked in this sector, it's very difficult for them to get the budget, right? So, you know, they need a system in order to manage the whole relationship through the life cycle and to sort the wheat from the chaff. I mean, you may have a very, very large population of third parties. Which ones do you need to actively assess and manage? Certainly not all, right? It's a subset of those. So you need a reliable intake process to say, okay, if I'm going to segment my relationships, which ones matter enough that I'm going to put a lot of effort into the management side of things. Without technology to support you, you're going to really find it difficult. Plus, I mean, some of the larger organizations, they end up being super siloed, right? Because they're being pulled in a lot of directions. Patient care is number one. However, running the organization is how all that happens, right? So that back office or head office or whatever you want to call it, underpinning of healthcare and health sciences is essential because everything runs on tech these days. So, you know, I read that I think, I'm not sure if it was in HIMSS or in AHA, that about 6% of an average budget goes towards cybersecurity. And I would say that, you know, there's always that fight for money. How is the organization going to find the money? And so if you're listening and you're interested in investing in something that will help you get through the process and be able to manage things, I would suggest that you probably come up with a pretty decent business case by really looking at the estimates of how much time it takes to go through and to do things manually. How much of the population of third parties can you reasonably expect to cover off with the resources that you have? and what's the cost of a breach, I think you could probably come up with a pretty good business case that says if you're going to perform all these activities, there's a very, very good business case to be made in terms of investing in technology, right? It might, let's say it costs you 100, 200,000 to install for a big company. If you compare that with the cost of a breach, which I understand to be in this sector about over $10 million per incident, after a while, I mean, the recovery is just so painful and so expensive. Maybe a little bit of prevention would have been a much better approach, sort of like patient care. So,
right. I think it's important to note, Linda, that like, even if you have a platform that automates a lot of the activities, there's still some manual work left, right? So to hearing vendors, for example, right? You have to decide if a vendor is critical or how critical they are to your organization. So
well, I just want to touch on one thing. The more and more time I spend in this area, which, as I told you, has been considerable, the more convinced I am that having a very strong and sensible relationship segmentation framework to allow you to determine what is the operational dependency or the reliance or the criticality, whatever you want to call it, that your organization has on this particular relationship or this engagement. And the second is, which risks are we being exposed to? If you can do a decent job of putting together a segmentation framework that allows you to determine that pretty quickly within 5-10 minutes, it is that work, that underpinning of your third-party risk management program, it'll drive everything from that point forward.
How many tiers exist in a best practice world?
Well, a lot of healthcare organizations use 3. I actually like 4 better. And the reason why I like 4 for in-scope relationships is you can reserve that top layer for those this handful of relationships you have that would absolutely cripple the entire organization if they fail, right? You think about, let's say you've outsourced network services or, all your application management, et cetera. Those ones are your heavy hitters. And that's why, if you said it was, 1, 2, 3, 4, 1, your top tier is a superset of your important relationships. And and that allows you to have a very, very sharp focus on things that if they go wrong, you're going to have to tell your regulator, you're going to have to tell your board, you're going to have to tell the public. Those ones, you just come to your knees. So a lot of healthcare organizations seem to prefer 3, but I think what that can do is make your top tier a little bit too bulky. And then you should have this other tier, which isn't a tier at all, which is all those ones that are out of scope. You don't need to spend the time and the effort on active risk management on an ongoing basis, which should be the majority of the population of your
like landscapers, which a lot of businesses have, but I get it. So does it have an impact to your business if they do something wrong or if they're breached?
Yeah. And what is the impact? And that'll help guide your relationship segmentation, which is the 2 elements, right? Your criticality / operational dependence and versus the exposure to risk. Because the operational dependence is going to tell you, you're going to give you indicators around, well, if they fail, what happens, right? So what's the impact? And then the risk is a different matter. Let's say that they have 3 patient records versus 1 million, right? So you want to know those things, what type of risk and how much.
We're going to cover some formulas for risk later in the
discussion. Oh yes, we are.
I'd be remiss if I didn't mention Engage, and Engage has a great platform and it automates a lot of the functionality and those kind of things. I just wanted to flash this up. I think it's important I don't know if you have anything that you want to add.
Yes, I do. In the spirit of disclosure, I was introduced to the CEO a few years ago, and I really think that this is an excellent platform. And so I am on their advisory board, right? So I don't take paid endorsements, but I think that they've done a really good job on the lifecycle management. There is a really good facility for encouraging innovation, which is, something that healthcare and health sciences and health services organizations want to do, but are always, a little concerned about. And of course, the exchange, right?
Yeah. And I think they do a great job understanding and evaluating risk, quite honestly. And that's what third-party risk is all about, right? Just really understand.
Exactly. Yes.
I want to just ask you some questions and get your thoughts on those. does anybody care about my data? I mean, that's the subtitle of this webinar, but seriously, for a healthcare company, does anybody care about my data?
Well, I'd ask the question as well. Like, there's no doubt about it that the healthcare providers, they do care about the data. And the question is basically whether or not they have enough time or resources to do anything about that. So I don't doubt that certainly the spirit is willing, but the resources have to be available there. Now, I would also note, though, that because there's a lot of innovation, especially in the medical device area, that you just can't assume that these devices are secure, right? They're all connected devices. Many of them are connected devices. And so the focus of the developer or the technology provider is always going to be on, patient care and what it's for, versus, and certainly with a strong nod to security, but it's vitally important that healthcare companies do examine the security of the devices themselves, because those provisions, not just in this sector, but in others, that the technology providers they want to get the product to market. They certainly are aware of cybersecurity and other type of security requirements, but their ability to deliver against them is very uneven. So any connected devices really have to be closely examined for their security.
Right.
And it's such
and we're going to talk about that a little bit later too.
Yeah.
But the FDA has something to say about that, and they just implemented a set of controls that require cybersecurity be integrated into the device.
Yeah. I was really glad to see that, Steve, because I think it's been, it certainly has been out there, but I see other, sort of regulated industries now going in the same direction. I mean, energy just 2 years ago came out with their first cybersecurity regulation, which was surprising to me. It took so long. Right. So it's really important that the regulators are behind this, because sometimes that's the only reason why executive management will pay attention, because there's a compliance requirement. And that's often where it starts. And then they start to see the business benefits of doing this well.
Yep. And I went to the bad guys thinking if you look at the black market, healthcare records are worth 50 times as much, 250 versus $5 for a credit card, right? So I know credit cards are a little bit commoditized, and people are like, hey, if somebody steals my credit card number, I'll just call the company up and get a new card, right? So
right, and it's their problem, not mine, because
right, but a healthcare record is different, right? That's and like I've heard the saying that a healthcare record stays with you forever, right? And if you have a medical history, it's never going to go away, right? It's never not going to be part of who you are. And anyway, that's probably why the value is so high on the black market. But that's where I went with this question. I think there's people are attacking healthcare networks because they get so much money for it, right? 50 times what you get for a credit card.
And you have to ask yourself, why is the information so valuable, right? Because it certainly makes identity theft easy. But secondarily, that information being as confidential as it is, there are a lot of people in this world with a public profile that don't want their medical. I mean, they really, really would, their career and everything would be damaged if their medical information was public. So there's a reason why this is more valuable than other types of information that's available on people. So I think, though, that the dark web is an interesting problem, and one of the things we're finding as well is that, especially with some of the new technologies around chatbots or chat GPT, right? So we're starting to move into new types of technologies that just make it a whole lot easier for the bad guys to trick people into revealing confidential information, right? Because they can imitate legitimate sources so easily. But it's back to, do they care about my data? There's no doubt that the sector cares about the data, and equally the people care about it a lot more than they care about almost any other thing, any other type of data. I mean, obviously, if somebody steals money from your credit card or your bank account, as long as you can prove it wasn't you, you're going to be whole. There is nobody who can protect you once your medical information has been stolen. because it's so personal and it's unchanging, right? You can't just go and replace it with some other medical information,
Right.
even if you want to.
I want to talk a little bit about risk equations, and I know that this is a matter that's near and dear to your heart, and
Yes.
but which equation do you think is most valid?
Well, where I really struggle, I like the more complex one on the bottom. The top one, which is the likelihood to the impact, is the risk exposure. That's been around for a long time. When it comes to third-party risk, I actually don't think that that it holds water. And the reason for that is that A, there's not enough data in the world to tell you what the real likelihood is. And B, the environment is changing so quickly all the time that the likelihood factor is going to be in flux no matter what you do. So I have never been a fan of that equation when it comes to third-party risk. So when we start to move into other types of equations, what you're really looking for is you're looking at the means times the modus, the opportunity. When we talked about this a couple of days ago, I thought this is actually pretty cool, right? It's thinking about risk in a much more thoughtful way. And so you always want to understand the business impact, because the business impact in terms of impact on patient care, impact on records, et cetera, the reputation of the organization, and the financial impact of a risk event should be taken into consideration when you're actually designing your risk management program, and how much effort you put into different activities, right? Because nobody has enough money to manage risk thoughtfully, or sorry, not thoughtfully, completely, because then you wouldn't be able to have any money for anything else. So when I step back and look at it, I think that the means basically really ties into risk controls. So third-party risk management is different than many other types of risk, because you don't have any actual control over the third party themselves and how they run their business. But what you do have control over is your ability to determine what controls are appropriate to have in place, and does the third party, you can go and evaluate whether the third party has the controls and whether or not they're adequate and match what you think is needed or your own controls. And so that basically allows you to really hone in on the means, because if those controls are weak, that's how things happen, right? You think about something fairly simple, like, let's say you decide to go on vacation and not lock your front door. Well, you know what? You have just overlooked a control, and you're providing the means by which something bad could happen to your organization if somebody happens to notice your front door is not locked and you're gone for 2 weeks. So, these are sort of like, they're simple concepts, and they are absolutely essential in order to manage risk, any type of risk. So that's why I like this more complicated one, is that means itself touches on the control environment itself.
Yep.
And that
I like the most complex one too. And the reason is pretty consistent with yours. The means plus motive, I think, is a really valuable part. And like the motive, what this basically says, if the bad guys, they don't have a reason for attacking you, they're not going to, right? So a lot of motives are financial in nature, right? So they're going to gain something financially from it, and ask you for money, basically.
Well,
right?
yeah. Yeah.
But that's a valid motive. And I'm not saying that their activity is valid. I'm just saying that the motive is valid, right? So because they're going to make money off you.
Well, yeah. They're in the business of being criminals.
Right. That is their motive, right?
Yeah.
But
And then
some other types of breaches maybe have different motives, right? But the motive always has to be present, or they're going to just pass you by, right? But the other reason I like this,
I've been reading crime fiction lately, and means of motive and opportunity, isn't that the equation for crime?
Yeah. Right. But the other reason I like this equation is because of the controls, right? So like cyber insurance is a great example. Professional risk takers, right? So for years, it's one size fits all, right? They charge whatever they charge based on something, right? Filling out a questionnaire or answering something. some questions, right? But here we're saying risk is inversely related to control. So if you put a control in place, like antivirus or anti-malware or something like that on the endpoint, then you should get rewarded for that investment, right? So if you're spending money on security, you should get rewarded for that somehow. In any event, I think it's great that risk is considered. It should say effective controls, in my opinion, right?
Yep.
You can have controls in place that don't work, and there are a lot of those out there as well. But that's another discussion.
Maybe you could just touch on this, because basically, I mean, it's always nice to come away with some nuggets of information from a webinar. And when we were preparing for this, you were talking about a partnership you have with an organization that actually does testing on for the cyber controls. Can you just talk a bit about that?
Yeah, breach attack simulation. That's
the word. Yeah, that's the term. Yeah.
Yeah. So basically, what they do is they use TTPs, tactics, techniques, and procedures to basically attack you and identify the controls that either stopped the attack or identify the controls that didn't, right? So this is a really good way to know if your controls work, right? So if you put a set of controls in place, then this is a logical next step, right? You should attack them and see if they work, right? And that's what the purpose of a pen test is supposed to be, right? But the problem with pen tests is they only happen, once per year or once every couple of years or whatever.
And also, I mean, it's all permeable, right? Because you have this really complex environment with lots of connectivity. So let me just ask you, so that's testing your own environment. Would that include that? Would the test include the connectivity that you have with that you've allowed to networks for your networks and systems where you granted access to third parties? So can you test for that as well?
Oh, absolutely. Yeah.
Well, that's really important.
Yeah, it is really important, especially as it relates to third-party risk. So I think the premise is basically that you test your own environment, right? So whatever you own, you test, and that whatever controls you have in place, even if they're access controls, are tested by virtue of that. So I think it's a good idea, and I just want to reflect a little bit on like the once per year or less frequently pen test. The challenge with pen tests is that they have to be scoped, right? So you usually only test a small portion of your network or environment, and you test for one thing. Maybe it's an internal test, maybe it's an external test, but in any event, that you're testing, an application, a specific application, or some specific thing, right? It's not everything. And what breach attack simulation, BAS, is designed for is being able to test everything in your environment continuously, right? So it's not once per year a small portion of scope, it's everything. And
that allows for that concept of continuous monitoring, which has been somewhat elusive for a lot of organizations. So one of the things that came to mind when we were talking, Steve, is sometimes people that I've talked to in organizations don't really, especially at the more senior level, they don't entirely understand what third-party risk management is intended, what you're actually doing, right? So it takes a while for that penny to drop at times. And that's why, and communicating these things to your senior management are very important. So what they see is that their own environment as an organization is adequately protected, right? So they've got good people and they do pen testing and they do all kinds of things, and they're looking in the environment that they're operating in. So what third-party risk management is all about is actually looking over the fence at the third-party population that you have and seeing how they run their own environment. Because anything that they do in their environment, as it, where it touches your environment, is in fact is where the potential breaches are coming from.
Well, I'm sorry. Go ahead.
Well, I just want to make sure that I'm clear on this point. A lot of times when I talk to senior people, they're not quite getting that we're over here looking at each important third party and how they run their business, to make sure those controls are up to snuff so that when they're interacting with our business, that they're not going to harm it,
Right.
right? And that's hard to explain to people.
The concept of fourth party or nth party, right? That's it's naive to believe that your customers, who are your third parties, right, don't have third parties themselves, right? Because everybody is today. So I think what's important is just, do they have a mechanism for evaluating the risk of third parties, right? So if you look at your third parties, one of the things you ought to look at is, do they have a third party risk program? And if they don't, like, I've been asked this question by customers all the time: what if my vendors have risk? And my response is pretty much the same all the time. Like, our job as a vendor is to give you the information that you need to make the best business decision possible, right? So if your vendor's risky, we're just going to tell you they're risky. We're not going to tell you what to do. But I think a lot of people don't know what to do, right? And they want to know what to do, right? So maybe there's some room to really elaborate on that some.
That's very true, right? Because basically, the point of a third-party risk management program is to make risk and to allow the organization to make risk-informed decisions so that they know what they're up against. But when there is, a higher level of risk, then what? So one of the things that I learned in the financial services sector is they have this concept called effective challenge. But the word challenge is really not, it's really not politically palatable in most organizations that are not sort of bound by regulations that use this term. So one of the things that I've kind of migrated to is this notion of high risk decisions. So if in fact you do the evaluation and you see that the risk is high, and you've gone through the litany of risk mitigants that that you can possibly think of, do you pull back some of the services, right? So you're not using the risky elements. Do you pull it from an offshore location and move it to a different data center or to a different service delivery location? Do you have more monitoring and oversight? Do you contractually bind the third party to improve some of the controls that you're concerned about? All of those things may be mitigants that in fact would work. But on the other hand, let's say you go through a renewal process with an existing third party. You don't want to leave them. They're highly embedded in your organization. It's always risky to switch. So now what do you do? Because your processes have improved over time and you have realized that either you didn't notice some risk that was there because you weren't performing these activities to evaluate it, or things have changed and the risk has increased, particularly on the financial health side. That's very, very real in the sector. So now what do you do? In the past, before third-party risk management became a risk discipline, it would get chucked over the fence to the business owner and they would say, well, here's the risk, what do you want to do? Like, you can accept it. Well, accepting the risk, just foisted it on your business partner does not make any sense, right? It's like, I never understand why people think that's okay. Okay, well, we couldn't mitigate it, so here you go, you accept it. That's kind of like crazy talk in my mind. However, there are legitimate reasons to proceed with this third-party relationship. Either A, because getting out of it would be very complicated, expensive, and risky, or B, you don't seem to have any other options. They're the best choice and for many reasons. So that's why I've changed the terminology in working with people, and I call this high-risk decisions, right? So you have people who are risk specialists who have a look at it. They try their best to mitigate, but they're unable to do so. So the escalation path should be clear. Where does it go next, right? For examination, and where does it eventually land for approval? And I have all the clients I've ever worked with, at some point in time, it actually goes up to the senior leadership team or executive team or whatever you want to call it. The people who run the organization, they become aware. There might be 1 or 2 a year of these, but they're aware of what's going on. So at least they know the risk is there. And that would be in itself of value. But it's back to, what do you do? So, I mean, you've seen a lot of things too, Steve. I've thrown out a couple of ideas on how to mitigate the risk. What do you think? Honestly,
I think it goes back to the way adults problems is to put them on the table and talk about them, right? So, and I think communications are critical in situations like this, right? So both communications between the company and the vendor and communications within the company, I think are critical. So just understanding that you have risk is the first step, right? Then what do you do about it? You can do procedurally like a series of things, right? Get the vendor, talk to the vendor about mitigating the risk. I think that's, so to you, like you said, assuming the risk is, I'm not willing to stay up all night, but I want you to stay up all night.
Right.
It's just handing off problems, in my opinion. So that isn't, I don't think that's a good idea in any circumstance. But I do think talking about it is appropriate, right? And I'm not saying fire the vendor, or I'm not saying don't fire the vendor. All I'm saying is talk about it and decide what to do and evaluate the cost of doing something different, making a change in your organization versus keeping the vendor. But definitely mitigating the risk is important.
Yeah. I'm still with you, and you're right. That's how adults behave. And so I really like the idea of sort of like some sort of a council of risk specialists in procurement. We can bring in people from compliance, from different risk disciplines, bring your procurement people in, and really have a look at this and see, what do you collectively think? Because you don't want to have one person over here with their hair on fire and the other person saying it's not a problem, right?
This is a good lead into the next question. Like who should own third-party risk? Should it be security? Should it be compliance? Should it be supply chain?
Yes.
What do you think?
Yes. Everybody is a risk manager, right? Everybody is a risk manager. So I guess when it comes right down to it, how do you stay in your lane is a good question, because there needs to be a third-party risk management program. One of the things that I see, especially in this particular sector, is that there's a lot of people working super hard, but I find it's very common that the third-party risk management program is not by any stretch of the imagination integrated, right? So you've got your business continuity people over here doing their thing, and your cybersecurity and your tech people and procurement and compliance, et cetera. And so despite their good intentions, they don't have a way to work together for the greater good of the organization and ultimately the patients. So when it comes right down to it, I think that there needs to be a program designed, an intentional program that's got guardrails and it's got processes and it's got tools and templates and technology. And I think that somebody does need to own the program itself to make sure that you can get from A to B on some sort of vendor or third-party relationship and get things moving forward. Because the hardest thing is, for people to manage is they're sitting in the business, they need a relationship put in place. And every time they think they're done, somebody says, oh, you got to go talk to these guys, right? So let's say you've got a country risk group and so having an integrated approach, whether you're in this sector or others, that's where everybody is really focusing their attention today. Because if it's integrated, you have a common view of risk for the organization. And it makes it a whole lot easier for everybody to know when to come in and out of the process. So that if you're sitting over here in a hospital or in one of the headquarters functions, you just turn it into you just put it into the process with some sort of an on-ramp intake process, and you let somebody else guide this through the process itself. So when you ask me who owns it, everybody who has a risk domain specialty and expertise in certain areas should be held accountable for determining what controls, how do we identify the risk, how are we going to evaluate it, how do we mitigate the risk, when do we need monitoring and oversight, but stay in their lane, right? And that's easier said than done, because when it comes to this topic about cyber, I find that you have people in the technology and information security and records management. Quite often they're trying to do the same thing in slightly different ways, and there's a real overlap in what they're doing. So quite often I'll work with people just to figure out, well, what is the lane where you are accountable and you're also have ownership over what happens?
Yep. Yeah, I think that's a great answer, Linda. It's a shared responsibility, in my opinion, right? queuing it up as whoever has wisdom, the most wisdom in that risk specifically. So if it's geographic dispersity, for example, that's probably the supply chain owns that part of risk. And if it's complying with a regulation or whatever, compliance probably owns that risk. If it's cyber, to your point, security probably owns that risk. But in any event, I think the owner of the risk is probably the person who should be accountable for that. Third party risk. The other observation I've had is that third party risk gets equated to cybersecurity most often, right? But there's so many other aspects that can influence the risk of a vendor or the risk of a third party, right? So I think there are other risks that need to be evaluated. Is that correct?
Well, the top, yeah. So if you're relatively new and you're trying to integrate or trying to build a program, there are 4 that in my mind in this sector that should be addressed immediately. Obviously, you've got cyber, business continuity management, financial health, and compliance. Because basically that's really, if you can't do anything else, if you do those really well, that's a really good start. So the cybersecurity, well, it's a lot.
That is a lot, yeah.
But Steve, in the long run, I mean, you get all these interrelated risks, right? Because when I was doing the research, let me just put my glasses back on. I was looking at to see, well, where are the breaches coming from? And so we talked about the complexity of the relationships, but let me see. What we're finding is that cybersecurity budgets are pretty small, but we know that some of the basic securities controls might not even be in place for small providers, and that basically phishing is actually driving about 57% of the breaches in the sector. So phishing, basically, you think about your own protocols around preventing phishing, but what about your third parties? Because once they're in, right? That is kind of the lesson that we've learned. The ransomware attacks are on the rise. So basically about 20% of all risk events today are now related to ransomware. And I don't know if you remember this, but this was actually, I've had this in my course and in my book. Every time there's a major watershed risk event, that's something that I really glom onto. So the one that I was thinking about was actually a few years back, WannaCry, right? It took down the National Health Service in the UK for like 2 or 3 weeks. It was really, really extensive. So, every time you hit a new one, the newest watershed event that I think happened was SolarWinds, right? Where basically you have now, possibly even in your own organization, not yours, Steve, but many of the people listening, where basically that breach was successful, and that breach is sitting dormant in systems, and it's almost impossible to identify because they go in and because it allows them to get in, change credentials behind themselves, and look legitimate when they're in there. So you've got like a real watershed breach happening there, and it may not even have come to light yet. But 7 major U.S. agencies were affected, and over 130,000 companies around the world are known to have been breached by the SolarWinds breach. So
that's a big number. That's a lot of organizations, by the way. Yeah. I participated in a cybersecurity event in a city close to me, Columbus, Ohio. I'm in Cleveland, Ohio. But in any event, the panel moderator asked, "What keeps you up at night?" And my comment was, third-party risk keeps me up at night. Like, I don't want to be the third party that's responsible for a breach at one of my customers. So we put a lot of emphasis on security controls, but we all know that, and we've heard countless times, if they want to attack you, they will. If they want to be successful, they will. Yeah. And I don't want to be responsible for that.
I know, and they're getting so good at it. I mean, it is so easy to fall for things, because with things like with these new technologies like ChatGPT, there is a real escalation in the concern around cybersecurity breaches, because it will be so much easier to imitate legitimate sources. Yeah. But I don't know about you. I mean, I have a small business. I must get, I don't know, 10 or 12, things showing up on my junk mail every day purporting to be my HR department or my this or my that, right? Encouraging me to do something, or I have a delivery coming and I just need to click on this link to receive. It is just relentless.
Relentless.
So when you think about how important healthcare records are, the people in this sector are probably kept up a lot at night trying to prevent risk events from happening, and then to try and recover from them as quickly as possible. Because the thing about reputation risk is it is a consequential risk, right? It's a result of a risk event occurring. And so when you think about the real breach of trust with a client of a healthcare organization, it's really once you get into those medical records, that is a breach of trust that is not like a credit card breach. It's not like any other. I know we've talked about this, but I just want to emphasize that the reputational impact for a breach is different than almost any other sector.
Right. Yep. Why do you think third-party risk is so important in healthcare?
Well, I think that the importance is not yet fully realized. I would encourage you, if you're in a healthcare organization, to find ways to better educate your executive management. And if you're fortunate enough to have something that looks like an enterprise risk management group, is to help them become more aware of why third-party risk should be on their top 5 or top 10, right? It should be on the board agenda. It should be part of the C-suite discussions from time to time. And I think that because there's so many other things about patient care that call their attention and so many compliance requirements in other areas, it gets lost in the discussion. Mm-hmm. So I think that basically the overall importance, Steve, is still underappreciated in this sector. So as you mentioned, I mean, the number one headline, of course, is healthcare record breaches. But there are many, many other reasons why you would want to pay a lot of attention to third-party risk management, because it will directly affect your patient care. So I got some statistics from HIMSS as well, talking about the impact of threat actors. So this is from their 2022 cybersecurity survey. And so when I was looking at the impact of, it's obviously employee and financial information, et cetera, and what it's going to do. So the disruptions, basically, it's 61% for non-emergency medical and clinical care. All of the rest of them were directly affecting patient care at that moment. Emergency services, injuring or causing patients harm, diversion of patients, you can't even serve them in your facility, or being forced to cancel surgeries. So you figure, like right now, almost 40% of cyber incidents are directly hitting ongoing and daily patient care. So this is the emergency stuff. And also that the type of data that they're stealing basically is not replaceable. Right. So, when you start to look at the incidents, like, it really does make a strong case for investing in them.
And that's where I go. Like, if somebody steals a health record, it has implications for a long, long time, maybe even forever, right? So that, like, from a patient care standpoint, if I'm a patient and my medical record gets stolen, like, I'm going to be affected. There's no question. So,
well, part of the problem is that it's not just being stolen, right? Because what we're finding, especially with ransomware, is that there's no guarantee A, you'll get the records back, and B, there's no guarantee you'll get the records back in the quality and integrity of what you were taken, right? So A, you may never get them back as an organization, and B, when you do, they may be corrupted, right? So there's also the opportunity to change medical records, right? So there could be, certainly, we're looking at rogue nation states attacking the U.S. and other countries. So it's not just that they could be stolen and sold on the black market. Right. It could be affecting individuals, could be targeting individuals as well. And I think that's a great concern, because the more sophisticated the attacks get, the more sophisticated the damage will become, or is becoming.
I think so too.
Mm-hmm.
I think we're about out of time, so I'm just going to I had a slide for the current regulations. Was we all know the FDA has just implemented a cybersecurity requirements for medical devices, and devices are prevalent. When's the right time to start doing third-party risk, by the way?
Oh, I would suggest that all healthcare organizations, all organizations are doing this to some degree. I think the real question is basically, when are you going to step it up and actually take this seriously as a really important part of your risk management strategy and practices for the organization. So I don't doubt people are working hard, Steve. You know, they
Yeah,
are.
from a third-party standpoint, the time to start is like before you add the third party, in my opinion, right? So,
well, yeah, if you want to be very
do due
specific,
diligence, evaluate vendors before you add vendors, right? Especially if they're going to have sensitive data.
Well, when I wrote my first book, I have to say that what did I actually learn? What I actually learned is it really matters which vendor or third party you choose in the first place, right? Because they will help bail, they'll protect you and they'll bail you out because things happen, right? They will, and they do.
Yeah. We're fastly approaching being out of time. So I just want to mention a couple upcoming events that we have. This webinar, obviously, and June, the beginning of June, we're going to be in San Diego for AI Med, and that'll be a good program. And I do have some free passes to that if you're interested in going. If anyone's interested in going, please send me an email. And again, the giveaway, your book, Linda, thank you so much for being here. I really appreciate it. And your wisdom is astounding. And I always enjoy discussions with you.
And likewise. So thank you very much for inviting me. I appreciate it. And thanks for listening, everyone.
Cheers. See ya.
Thank you. Okay, bye.